There is growing concern over the increasingly incendiary nature of the discourse in the public sphere over differences regarding the national pandemic response, with appeals for a moderation in the tone of commentary. A mix-up in some quarters over the distinction between the Medical and Dental Council, which regulates the medical field, and the Medical and Dental Association, the trade association of healthcare professionals, continues to drive alarmingly inflammatory remarks aimed at the SLMDA president.
When it goes from criticizing makeup and hair, and she speaks fast and whatever, to being an outright threat, that's when it becomes not so funny anymore.
Internet trolls and provocateurs have taken to social media with threats directed at the SLMDA in the wake of the Medical Council's sanctions against Dr. Gilbertha St. Rose over the unauthorized use of ivermectin to treat patients for COVID-19. Her practicing license has been suspended, and she has been hit with a $10,000 fine. The SLMDA head, Dr. Merle Clarke, is not affiliated with the Medical Council. However, her pro-vaccine stance and promotion of proven public health measures have drawn the ire of denizens on the fringe of the pandemic debate.
This was in response last evening to the announcement from the St. Lucia Medical and Dental Council. Different is the registration body for physicians and dentists, completely different from the St. Lucia Medical and Dental Association, which I head. As to our position on this, we have not said anything, but there went somebody, Merle Clarke, you are part of it, your time will come, and you, what is it? You will disappear and nowhere to be seen. And will ask yourself, what does it say, questions one day.
Dr. Clarke has condemned the threats. The SLMDA president also expressed alarm at the level of vitriol spewed on social media platforms, making it clear that the body which she represents had nothing to do with the Dr. Gilbertha St. Rose ivermectin decision.
So I'm literally just wanting the names of people who liked that statement, that exact one. And I felt we needed to shame them, and that's exactly why I took that screenshot, to show who were the people, because those were real names of real people who thought that this statement was okay. Women involved in it. And for what? Simply because we've continued to say, and we will continue to say, that vaccination is the best way out of this pandemic.
The medical professional says she is wedded to the Hippocratic Oath to do no harm and will remain a staunch advocate of vaccination, touted as an effective tool in breaking the chain of transmission of the deadly viral disease.
The reality is we are physicians and we're duty bound to give the best clinical, best medical, best public health advice, along with the Chief Medical Officer, the Office of the Chief Medical Officer, to the policymakers. And that for us, as far as we're concerned, what has been shown, and this is not coming necessarily from us, this is what the science shows, that those public health measures and vaccination are our best way out of this pandemic.
The Dr. Gilbertha St. Rose saga has elicited strong emotions from vaccine skeptics and the ivermectin community, who swear by the antiparasitic as a prophylactic. Dr. St. Rose, who has a right of appeal, can renounce the use of ivermectin in a written statement to the council to have the suspension reviewed.
They cannot take my license. They cannot take my license.